Our goal at Helio Genomics is to save patient lives by detecting cancer early. Our first product, the HelioLiver DX test, aims to detect hepatocellular carcinoma or HCC in high-risk patients that have been previously diagnosed with liver cirrhosis. Liver cancer is one of the leading causes of cancer-related mortality worldwide, causing over 700,000 deaths every year. While it's more common in Southeast Asia and Sub-Saharan Africa, in the United States, according to the American Cancer Society, over 40,000 people have been diagnosed with liver cancer so far in 2024 alone, and an estimated 29,000 patients have died due to it. Since 1980, the rates of liver cancer incidence have more than tripled, and within that same time period, the rates of liver cancer-related deaths have more than doubled, driven in part by the increase in rates of non-alcohol-related liver disease, such as metabolic dysfunction-associated steatohepatitis, or MASH, and metabolic dysfunction-associated fatty liver disease, or MAF-LD. Overall, 5-year survival rate for patients diagnosed with liver cancer is about 22%, based on patients diagnosed between 2013 and 2019. However, the 5-year survival rate for patients diagnosed at early stage of the disease and who go on to receive liver transplants is about 60 to 70%. This shows that the key to better patient outcomes and prognosis is not just developing new and improved treatments, but also detecting liver cancer early. HCC, or hepatocellular carcinoma, makes up about 90% of all liver cancer cases, and 80% of the patients diagnosed with HCC have underlying liver cirrhosis. Under current guidelines, patients with cirrhosis are typically recommended to undergo routine ultrasound screening, with or without measuring serum levels of alpha-fetoprotein, or AFP, every 6 months. However, adherence to ultrasound surveillance remains poor due to socioeconomic factors, patient access, as well as difficulties in scheduling. According to several studies, less than 20% of the patients who should be screened routinely adhere to surveillance. Moreover, ultrasound often fails to detect early-stage smaller lesions. As such, the goal of the HelioLiver DX test is to both increase adherence to testing as well as detecting cancer early. The HelioLiver DX test relies on detecting changes in methylation patterns associated with cell-free DNA fragments in a patient's plasma, as well as serum protein biomarkers and patient demographic characteristics to detect HCC in cirrhotic patients. Cell-free DNA fragments, which are released into the bloodstream from dying tumor cells, contain the underlying aberrant methylation patterns associated with the cancer cells from which they are derived. Detecting such fragments and quantifying their methylation changes can thus be leveraged to detect HCC. Helio's proprietary wet lab platform, Eclipse, is used to extract cell-free DNA from a patient's plasma, and an enzymatic conversion approach is used to convert unmethylated cytosines to uracil. A targeted sequencing panel that was designed by Helio is used to enrich for the aberrant methylation signal in regions that are most relevant to HCC. Our custom bioinformatics pipeline and proprietary machine learning algorithm quantifies such changes in methylation patterns in HCC compared to cirrhotic patients, and combines this information with the patient's serum protein biomarkers and demographic characteristics like age and sex to provide a final test result, which is positive or negative. We recently completed our pivotal multi-center prospective clinical trial study called CLIMB, and our results indicate that the HelioLiver DX test is more sensitive than ultrasound to detect HCC. Using MRI as the gold standard to determine the patient's HCC status, a head-to-head comparison was made between ultrasound and the HelioLiver DX test for identifying HCC in cirrhotic patients. The HelioLiver DX test outperformed ultrasound by 4 times in the detection of early-stage or T1 lesions. Moreover, ultrasound failed to detect any lesions that were less than 2 cm in the CLIMB study, while the sensitivity of HelioLiver DX for detecting lesions less than 2 cm was 28.6%. The HelioLiver DX test detected all stage 3 and stage 4 lesions, and the sensitivity for stage 1 and 2 was 44.4% and 60% respectively. Through increased adherence and earlier detection, the HelioLiver DX test has the potential to vastly improve patient outcomes and save more lives.